All right, guys. Oops. All right, guys. All right, we're good.
Okay. We're going to talk about karoshi. Karoshi means death by overwork. It's such a problem in Japan that it has its own name. And in order to stay ahead in a very competitive workplace, many Japanese workers are sacrificing their health for longer hours at work. After World War II, Japan's prime minister made building the economy his #1 priority. He enlisted major corporations to offer their employees lifelong job security, asking only that workers repay them with loyalty. This was very successful but has led to other problems as well. Karoshi deaths are attributed to heart attack, stroke, stress, suicide, and even starvation. Statistics show that they are second in the world for the most employees who work over 49-hour work week. Not only are normal work week hours excessive, but many workers clock in unpaid overtime of 80 to 100 hours a week. In 2015, 96 deaths were recognized as deaths due to karoshi. However, over 2,000 people killed themselves due to, at least in part, some difficulties they faced on the job.
So our solution for this would be to implement some health and welfare consultation services. This would be done through what we call gatekeepers for life. So these gatekeepers are trained and experienced consultants who would have education and experience in mental health counseling, as well as business development, team building, psychology, and other related fields. And so they would be specifically going to companies to assess what their needs are for employee health. So they'd be looking for different signs of risk or of concern with specific employees, as well as just the culture and the workplace in general. Some of the advantages that we see with this gatekeeper program is that the consultants would be coming in with a fresh perspective on the company. A lot of the time, employees and administrators get really ingrained in the company that they're working for. They get used to the same ideas and the same processes and things. And so someone coming from the outside would have a fresh perspective on it. They'd be able to recognize concerns and recognize possible improvement strategies. They'd also be able to get a good response from the employees, because it's not someone from inside of the company that they feel they need to keep up a certain image with. So they'd have that fresh perspective to recognize what changes need to be made. And then with that, they would be taking a look at specifically the work culture at that company. Japan has a very demanding work culture. People are generally just expected to put in whatever hours are necessary and to really put everything into their work. And that culture changes a bit from company to company, but that's really where we see the most changes are needed. So these consultants would be able to take time and observe the culture of that specific company and recognize what needs to be done, what changes they can make to make it a more safe and productive company. And with that, they would come up with a plan for change. So they would work with the administrators and the staff to improve employee satisfaction through different wellness programs or incentives, and help the company to roll that out so that it can continue after the consultants are gone. And finally, they'd also be educating the employees to make sure that they know how they can find a good balance for themselves between their life and their work. And there are a lot of reasons why a company would want to participate in a program like this. First off, it's going to give them specific solutions. Companies are already spending a lot of money on consultants for everything from their finances, IT, human resources. So this would just be another tool for them to use to find specific solutions that other people haven't implemented yet. They're also going to be able to save a lot of resources with this. They won't have to train as many new employees with people getting burnt out or leaving, or obviously with the karoshi issue with people killing themselves and or dying. And so it's better for the employees, and they save more resources that way. They're also going to have a better understanding of hazards and future concerns. This is as much to make a current change. It's also implemented so that the administration and the staff know what to avoid, what to look for as potential threats or concerns. They'll also be able to have documentation that they're trying to protect their employees. Lawsuits are always something that companies have to worry about, and this gives them a great way that they can show that they care about their employees, that they're trying to protect them and keep them healthy. It also helps them to establish programs and procedures that are going to better help employees to be healthy and happy. And it gives them a chance to train employees. And we also talked about working with the government to provide some sort of an incentive for companies that choose to use these consulting firms. This would be something similar to what we have here, where companies receive tax breaks when they are paying for employee health plans. Something similar could happen in Japan, where the companies have a tax break for the funds that they have to use for these gatekeepers for life, since it is helping the employees to be healthy and fulfilling an important purpose with that.
So the need for gatekeepers is that workplaces need to implement gatekeepers for life because the work is the cause and the source that lead to workers having symptoms of karoshi. Work is the reason many people start the path to suicide, so work should be the number one target for fixing the problem. Suicide is also the leading cause of death among Japanese college and university students. A gatekeeper training program was developed and tested on students to see if it would have an effect in lowering the suicide rates and raising more awareness on the signs and symptoms. After completing the training, about 95% of the participants rated the program as useful or very useful. 1/3 of the participants had one or more chances to utilize their skills within 1 month after completing the training. This training worked for students, and we think it could be very successful for the workforce as well. By using the gatekeepers for life, companies will have better control and be more aware over their employees. The program is based on 4 factors: knowledge about suicide, which means declarative and perceived knowledge about suicide, its prevention, and the resources available. Beliefs and attitude about suicide prevention is what they believe to be preventable. Reluctance to intervene are the perceptions people have that it is not their responsibility or that it is inappropriate to intervene. Self-efficacy to intervene is the extent which sorry, I can't see the slide. The extent which sorry. Okay, self-efficacy is the extent which the person feels comfortable identifying and caring for a person of risk.
Okay, and what is our hope with this program? So by implementing the gatekeepers for life, we hope to see a decrease of suicides in Japan. So we hope to save lives. The people that will be trained to recognize dangerous behaviors and intervene will share their experiences and touch other people's lives. We hope to make a positive impact on the population so that these risky behaviors can gradually change during the next years. Programs of this type, have been evaluated, they have been studied, and they show mostly positive results. One of the studies says significantly lower rates of suicide attempts and greater knowledge of more adaptive attitudes about depression and suicide were observed among students in the intervention group. The modest changes in knowledge and attitudes partially explained the beneficial effects of the program. These numbers were based on self-report suicide attempts. So we hope for positive results like that. Even though it will start with the workforce, we want to spread that throughout the country so we can have this positive impact. And another study says if every suicide affects at least 6 family members or friends, then every year in the world there would be about 5 million new survivors. Suicide rates range from 3.4 per 100,000 in Mexico to 34 per 100,000 in Russia. And in Japan, there are 21,000 suicides annually. That means that with suicide intervention for all levels, for all categories of suicidal behavior, we would be affecting 120,000 people because of suicide prevention. Our program would also help to reduce the karoshi deaths that are not considered suicide. So one thing that is important to know is that suicidal behavior can be something that inflicts self-harm. So if you're drinking, if you're smoking, like if you're using depressants, you're basically killing yourself slowly. So that's like can be considered a suicidal behavior. And actually, on the next slide, it says suicidal behavior has been conceptualized as a continuum of thoughts and behaviors ranging from suicidal ideation to completed suicide. And then there are 7 categories of suicidality. The first one is completed suicide. The second one is suicide attempt. The third one is preparatory acts toward imminent suicidal behavior. The fourth one is suicidal ideation. The fifth one is self-injurious behavior without the intent to die. The sixth one is non-deliberate self-harm. And the seventh one is self-harm behavior with unknown suicidal intent. And then there are primary, secondary, and tertiary preventions or suicide preventions. The primary suicide prevention aims to reduce the number of new cases of suicide in the general population. That's one thing that we would be achieving with our program. The second one, the secondary suicide prevention aims to decrease the likelihood of a suicide attempt in high-risk patients. We would be also dealing with that with our program as well. Tertiary suicide prevention occurs in response to completed suicides and attempts to diminish suicide contagion. Suicide contagion is clusters of suicide in a geographical area, just like what happened in Micronesia in 1986, where the young boys were killing themselves because they saw other boys killing themselves because their relationships were going bad or because their parents were treating them badly, and they thought it was the right thing to do, the right way to prove a point. And there are also copycat suicides that don't necessarily have to be in the same geographical area, but imitate another suicide. And then the secondary suicide prevention is important. So that's actually one thing that our program will be dealing the most with. And secondary suicide prevention is particularly important, but not always given the attention that it deserves, in part because research into secondary prevention is only just starting to be applied to clinical practice.
So we've identified cultural barriers, and unpaid overtime is unlawful in Japan. However, employees often feel compelled to work long hours as a form of sabitsu zenryoi, which means service over time. Japanese employees feel that they're providing a service to their company by working much longer hours without pay. In traditional Japanese companies, many employees are often pressured into remaining at the office until their superiors leave, which often extends far into the night. In a 2016 government survey, 1 in 4 of surveyed corporations in Japan disclosed that their employees logged 80 or more unpaid hours of overtime per month. Ways in which we think this barrier can be overcome is with more focused programs through companies and their gatekeepers on how to successfully manage work and life to create a work-life balance. Setting stricter work hours, which companies and employees have to abide by. Placing importance on health and wellness over service over time. Educating the public regarding the personal, mental, and physical dangers of overwork and, more specifically, karoshi. Work with the government and lawmakers to create and enforce incentives for companies and employees to follow safer work hours and workplace environments. Mental health stigma barriers are stigmas are a big problem in Japan, as it prevents people from seeking help and also stunts the development of proper mental health care. The components of these stigmas are lack of education, negative attitudes, and discrimination. People view people with mental illness as weak or incapable. People with mental illness also experience social exclusion and rejection. Ways in which we think this barrier can be overcome is with more education regarding mental illness, community health programs implemented at companies and through the gatekeepers, encouraging employees to seek help and to work on work-life balance, implement support groups for those with mental illness, and present company management with information regarding the benefits of healthy employees. Utilization and longevity barriers. There will always be resistance to change from the way that things currently are for both companies and employees. Many traditional companies will not be so willing to lose productivity for free from employees. Implementation of a gatekeeper program through companies may be not received well or utilized, depending upon how long it takes to get the program up and running, as well as how long it takes to be used and accepted by the company and employees might affect the program's longevity. Funding for the program will also determine the utilization and longevity of the program. Ways in which we think we can overcome this barrier is with lots of marketing and advertising regarding the program and its benefits to both the company and to the employee. Making incentives worth it for lawmakers, government officials, companies, and employees, reaching out to organizations for support, and applying for grant funding. Implementation and enforcement barriers. Many companies, in particular traditional companies, will be our biggest obstacles and source of concern in implementing and enforcing the Gatekeeper program. Companies benefit from free labor, and taking that away might be another source of contention or concern. Employees could be hesitant or fearful of the social views if they partake of the program. Ways in which we can overcome this barrier are providing education regarding company goals and objectives and how employees' health can negatively or positively impact them. Providing education regarding the benefits of healthy employees, productivity versus overworked employees' productivity, and fight for stricter labor laws within Japan. Incentive barriers. Incentives might not be enticing enough or worth it to companies, employees, government offices, or lawmakers. And we could face barriers in navigating the laws that are in Japan and trying to not overstep those laws with incentives, and then also breaking laws with incentives. Ways in which we could overcome this barrier are to make sure we research what companies need, what's relevant to them and their employees, and how best to provide their needs. Navigating laws so we don't overstep the laws with the incentives.